Hi, this is our presentation on physicians in healthcare. I am Imani Hill, and in my group, we have Tashay Giroux, James G, Maisha Jeter, and Yana Kelly.
Hi, everyone. My name is Yana Kelly, and I will be giving you a brief background and job description of a physician. So WebMD defines the term physician as a general term for a doctor who has earned a medical degree. Physicians work to maintain, promote, and restore health by studying, diagnosing, and treating injuries and diseases. So as a physician, there are 6 core skills that they should have either upon entering their field or over the course of their career. These include patient care, medical knowledge, practice-based learning and improvement, interpersonal or communication skills, professionalism, and systems-based practice. So as a pharmacy student, these core skills are very similar to some of the competencies that we should have as pharmacists. Some of the daily tasks of a physician include examining patients. Again, these are your everyday doctors who see patients and give advice on diet, hygiene, and preventative care. They prescribe medications, and they also determine appropriate diagnosis and perform different lab tests and interpret lab results for different disease states. So a brief overview of their degree and qualifications. The total education process of becoming a physician or a specialty doctor can take up to 15 years. The first step, the main one, is just completing an undergraduate degree from an accredited college or university. They must then take and pass the medical college admission test, or better known as the MCAT, in order to enter an accredited medical school. The third step, they should attend medical school, which typically takes up to 4 years. I did research and find out that some programs offer independent study years, which takes about 2 years off of the usual track, but I think those are mainly for overseas programs, not so much in the United States. After attending medical school, they should successfully graduate and obtain their medical doctor degree. And following their graduation, they must pass their state board exams after they complete medical school in order to practice in that state or whichever state they choose to practice in. One thing that's not on the slides is there are a set number of step exams that they should take as students during their medical school matriculation. And these are like mini board exams, one to just prepare you for the main board exam that you take upon graduation, and also to track your progress to make sure that you're keeping up with the studies and the education that's being provided. So after they graduate from medical school, they can obtain their residency or their specialty training at a different residency program. These usually last for 3 to 7 years. For example, the surgical residencies, which are usually the longer ones, last a minimum of 5 years. These residency training programs include an intern year, a resident year, a fellowship year, which is optional, and then they have their attending years, which they're like the main doctor on the team. And again, these residency programs just allow for further specialization in their specific area of interest.
Hello, I am Tashay Giroux. I'm going to talk about the additional certifications and specialties of physicians. So the standard career path for many physicians is medical school, residency, perhaps a fellowship, then practice. Most physicians also seek board certification, typically in a broad field such as internal medicine or family medicine. As their careers advance, however, some physicians find themselves gravitating towards more specific practice of medicine. These specialties include, but aren't limited to, hospital medicine, emergency medicine, urgent care medicine, pediatrics, neurology, disaster medicine, integrative medicine, dermatology, orthopedics, or anesthesiology.
Hello, everyone. My name is Maisha Jeter, and I'm going to talk about the impact on healthcare provided by physicians. So physicians are your traditional doctors that most people think of when saying they're going to the doctor's office or while in the hospital. Physicians provide a basic overview of care to patients, such as annual physical exams, point of care testing, such as flu exams. They allow patients to receive health care. Physicians provide continuous care to long-term care patients, such as elderly patients in nursing homes and hospital patients. They help provide learning experiences for student doctors, nurses, and residents while completing rounds. Physicians also provide educations to the patient, as well as help them understand their treatment plan and their illness.
Hey y'all, I'm James G. So I'm gonna be talking about the differences in roles between pharmacists and physicians. So first I'm gonna start with pharmacist roles, and that would be checking prescriptions before dispensing medication to the patient, ensuring the effective use of medications, facilitation of optimal medication regimen by adjusting pharmaceutical care plan, helping to prevent adverse drug reactions, and counseling patient medication. Also, they're in charge of ensuring the proper storage of medication within the pharmacy, such as narcotics and other controlled medications. So physicians' roles vary, such as first off, they may access their patient's medical history and physical examinations to determine the diagnosis of their acute or chronic condition that they may have at the time. They also manage and treat a variety of medical conditions, such as small cuts all the way to surgery. So you can see it's very broad in what they might do. They also provide the most optimal care for their patient and also try to educate the patient and family so that they can make informed decisions about their treatment plan.
Hi, it's Imani again, and I'm going to talk about how pharmacists and physicians work together. So normally you will see pharmacists and physicians having direct communication, and this occurs by physicians asking for advice on drug recommendations, pharmacists requesting patients' medication history, and sometimes physicians need help inputting prescriptions, as well as pharmacists need to ask questions about inputting prescriptions to the physicians. And they also share direct communication when rounding the floors in the hospital setting. Also, the patients always go to see a doctor. So doctor's visits can include seeing the pharmacist and the physician. So pharmacists will counsel patients on medication therapy for drug therapy problems, and the physician will consult the patients to diagnose and prescribe the appropriate medication therapy. At both of these consultations, they ensure that patients receive the best care by reinforcing the best healthcare practices.
Hello, it's Tasha again, and I'm going to share some light on National Doctors Day. So March 30th is National Doctors Day. It's an annual observance aimed at appreciating physicians who help save our lives everywhere. Doctors Day was unofficially celebrated for many years before it became a legal holiday. On March 30th, 1958, the U.S. House of Representatives adopted a resolution that commemorates Doctors Day. And on October 30th, 1990, George W. Bush signed the legislature after approval from both the House and Senate. The holiday first started in 1933 in Winder, Georgia, and since then it's been honored every year on March 30th, which was the first anniversary of a doctor using ether anesthesia by Dr. Crawford W. Lung. Today, we continue to celebrate medical advances like these and thank all doctors everywhere who spent so much time and energy mastering their field of expertise. So on March 30th, we would like you guys to step in, give a nod and say, thank you, Doc.
So here are the citations that we... used to gather the information of the different roles of pharmacists and physicians, as well as the importance of physicians in general and the different types of physicians that there are and what they may specialize in. And I believe that's all.